5 Facts on Healthcare reveals how insurance works in a poor economy. Most healthcare policies contain clear exclusions that exclude the benefits over something that may have been compensated by employers' compensation or related legislation. As a tip, read it again carefully. 1. Is your scheme defensive against you on and off the job? There are unique exclusions in certain healthcare policies that exclude the coverage over something that may have been compensated by employers' compensation or related regulations. Now, read the last line once again. Both the material was hidden. That is right. As is the standard in New Jersey and elsewhere, most self-employers and even some small businesses are not expected to bear policy focused on workers' compensation. Are there insurance policies created that will protect you on and off the job? 24 hours a day, if you are not allowed by law to provide provisions for workers' compensation. 2. Have you written it off down? Hypothetically, although certain independent contractors, 1099s, home-based business owners, lawyers and other self-working individuals are taking advantage of the tax laws available to them, the rest of these occupations are not taking advantage of the laws available to them. Anyone who is covering 100% of their own healthcare premiums are entitled to subtract the annual healthcare expenses from their next taxable income. It is estimated that picking a low-cost package on its own saves about 40% of the real out-of-pocket costs of a quality plan. Asking your accountant would supply you with the necessary documents, which you will find out from the IRS's website for more specifics. 3. Immediately restart at repeal section. Both insurance companies not only have a form of internal controls as a criterion to decide how much the plans can pay out on a given treatment or operation. There are 2 main approaches to smoke. Benefits that are better for the individual. Most programs, some of which are directly targeted to self-employed and single individuals, include a simple timeline on what they will pay per medical office appointment, hospital stay, or even restrictions on what they will pay for tests per 24-hour. And at times, this form of cover is also synonymous with indemnity plans. When you are presented with one of these policies, read the written schedule of coverage to prevent a misunderstood package and insurance charge. You should recognize that limitations are program limits. Not only do you not pay for them at the beginning, but when you opt into e-verif you only pay for what you need. Occurs at some point. Usual and normal refers to the rate of care for a visit, treatment or hospital stay at the doctor's office, which is based on what the majority of hospitals and clinics in that same geographical or equivalent area charge for the particular facility. The standard and customary fee is the maximum that most big care programs include in the insurance price. You have the opportunity to shop at Walmart. If you are reading this, you are presumably shopping for a package to get health insurance. Every day, plenty of people shop for many different items, from food to appliances. At the shopping process, the amount that you are paying, price, personal desires and general marketplace all get assessed by the customer. Noting that all expenses are impossible to come by, it is rather disconcerting, causing anxiety, that most people never think to inquire how high the expenses will be. The state of medical care in our country has been developing rapidly, so it is vital that these questions be asked of our medical professionals. Asking for a price would encourage you to get the best out of your package and reduce your out-of-pocket costs. 5. Networks and discount have been discussed. Almost all healthcare policies and incentive services work to access lower prices as they work with hospital network providers. In wide strokes, networks consist of medical providers and hospitals that choose, by arrangement, to charge preferential prices for services provided. The network, as a distinguishing feature of the program, may sometimes be one of the defining characteristics. The discounts can vary significantly, as the price can be as high as 60% off. Health network discounts vary, but before committing, it is important that you preview the network's list of physicians and services to ensure that you minimize the out-of-pocket costs. On the hand of the Understand Your Coverage, we want you to understand what the local clinics and hospitals have in networks. By doing so, we will just want to see what the options will be if you were to choose to see a specialist. When you contact your agent, ask to see a bill package, ask for a local or national network, and find one that fits your particular needs.